Good morning.
Good morning.
Good morning, Jamie. Morning, Wendy.
Hi, Abhilash. There, Jamie.
Hello. We will give our guests, I see that they are hopping in, so we will give them just a couple seconds to get in the room, but I am so excited to be here with you both today. I can't believe this is our third summit.
I know. The first one, we got the idea to do the summit like in June, and we somehow did that. Hats off to you guys. That was really, that was really a lot. That
It
was
was
really,
a lot. The summit is definitely all hands on deck project.
yeah.
So
I looked at the agenda and was sort of floored at how much and how big and how much ground is being covered. Like we always knew there was a lot to address and to talk about, and a lot of people who wanted to get involved and had things to talk about. But it's extraordinary to see how big it actually has become.
how big it has become. Just our reach is growing from a summit aspect and just from a program aspect. Our footprint is getting bigger, and we'll get into that. But it has definitely been a labor of love, I feel like, to do something as unique as the Within Health Summit. So, with that being said, I would like to officially say
Let's
good
go.
morning. Good afternoon, depending on where you are logging in from. Welcome to the 2024 Within Health Summit. My name is Jamie Singletary, and I am the Director of Clinical Brand Development. And it is my pleasure to be here with Dr. Wendy Oliver-Pyatt and Abhilash Patel, who are the co-founders of Within Health. And so before we get into our conversation, I would just like to I know that when we read their bios, sometimes they get a little shy, but we cannot help but just to share just how much you have done and just how much we appreciate you. So with that being said, Dr. Wendy Oliver-Pyatt is a world-leading expert on treating eating disorders with more than 25 years of clinical experience. She has developed 5 distinctive treatment programs, all grounded on a strong biopsychosocial foundation and incorporating intensive psychotherapy with behavioral foundations and high medical standards. Dr. Oliver-Pyatt has developed a unique treatment approach that delves into the underlying issues that place a person at risk for mental health conditions and eating disorders and lead to healing health and inner peace. Wendy received her specialty training in New York University, Bellevue Hospital in New York City. She has also held faculty positions at New York University, Albert Einstein School of Medicine. Whenever you say Albert Einstein, you just think smart and genius. I just need Albert Einstein School of Medicine and University of Nevada School of Medicine. Wendy is a board certified by the American Board of Psychiatry and Neurology in both adult and addiction psychiatry. She is the author of 2 books, most recently Questions and Answers on Binge Eating Disorder, a guide for clinicians. She is a fellow of the Academy for Eating Disorders and the International Association of Eating Disorder Professionals. She has received senatorial recognition for her commitment to mental health treatment community. And Dr. Abhilash Patel just gave you an honorary degree,
You
Abhi.
should have one. Dr. Abhilash. I'm down with that.
Oliver Patel is a proven entrepreneur, digital marketer, and active venture investor. He was the former founder and CEO at Rank Lab, a digital marketing agency that helps scale some of the largest behavioral health operators in the country. He also co-founded Recovery Brands, a digital publisher with assets including rehabs.com, recovery.org, and others. In 2015, Abhilash oversaw the acquisition of both companies to a publicly traded healthcare company. Abhilash holds a BA from Columbia University and an MBA from UCLA Anderson School of Medicine. Welcome, Dr. Wendy Oliver-Pyatt and Abhilash Patel. So, how did you all meet? Let's just start there. How did you meet?
Oh my gosh, the story. Do you want to start, Abhilash?
Absolutely not.
Oh, I thought you would.
No, I'm still reeling over like how what an extraordinary list of accomplishments that you had. And I was like, in the future, Jamie, you just got to do mine first. Like, I don't want to follow, I just don't want to follow Wendy's. And
Yeah.
so that's
I'm a girl
okay.
from I'm from Carson City, Nevada. I grew up next to a cow pasture. Okay, that's me.
It's fine. Please, no, I sincerely meant.
You want me to do that? Do you want
Yeah,
me?
yeah, sure.
Okay. Well, first of all, thank you everybody for being on this morning or afternoon. Like we are truly, and I mean this, honored to be able to have to do this within Summit. We really feel like this is an important kind of gathering because we're not just preaching to the choir. We're not just out there at an eating disorder conference. We're really trying to bring together like domains from other areas of life into the conversation. And I want to put my hat off first to Cynthia Johnson, who's the VP of brand at Within Health. And she called me one day before the summit started, and she was talking about in her communication with journalists, she found that they didn't really understand the language of eating disorders and they were almost afraid to write about it. And that really gave her, she was like, do you think there could be a meeting where like people from other domains all come together so that people could learn from each other? So she actually was like, I think the kernel of the start of the Within Summit. So I wanted to start by saying my hat is off to her for that. Was that was a really special thought that she had, and I think our summit is very unique and special. So anyway, how Abhi and I met, I definitely want to hear your version of it, Abhi, but we did we both knew somebody that worked in the behavioral health space that had worked with us separately. And at that time, I was talking with this person about my vision to start a telehealth mental health program. I really wanted to work with people in their home because this was before the pandemic, by the way, because I had begun to do so just out of necessity. I would get calls from people. I had like a patient in Norway. I had a person down in like the Florida Keys, and I was just encountering these calls of people who were really suffering but couldn't leave their homes. And so I began to treat some of these folks, sometimes in a kind of like a high frequency of sessions. I would do, if they were more compromised, I would do 2 or 3 and even 4 sessions a week, and I would text them and kind of do supportive things. And I sort of managed the food, the therapy, and the psychiatry, and just kind of did this conglomeration of treatments and interventions. And I called this friend of mine because I was like, I'll be darned, but like I could tell that the work that I was doing was really helping people. I was like, we're doing this in the home. These are people who have binging, who have overexercise, who need a weight restore. Like we're in the home, but we're actually like helping some people. So I had gotten that idea and I had shared that with him. And so he had also worked previously with Abhi and thought so highly of him and knew how brilliant he was. And so he just called me one day and he said, there's this guy that I really, really think you should meet if you want to do something, in the remote setting. And he introduced me to Abhi, and Abhilash and I met, and I think we really hit it off. We definitely had chemistry immediately. Abhilash has lived experience, which is really profound. And I think it is humbling for both of us to have had lived experience with eating disorders. And I think it helps inform every single thing we do, even though we may not be consciously thinking about that when we make decisions. I think it's a part of the DNA of Within Health and I wanted a partner that did have lived experience. Like I valued that. And when I was describing how I had sort of envisioned this working, I was speaking to Abhilash about all the love I wanted to give to the patients and the care. And he said, I hope it's okay if I say a bad word, but he said, oh, so we're gonna love the fuck out of the patients. He said that. And
Welcome to the Within Hit Summit. You're 18 and older. No, I'm
he
kidding.
said
It's
that.
fine. It's our summit.
I was gonna say that just the F. Anyway, I said it. Sorry. Anyway, he said that, and then I was like, that's my guy. And so that was it. And so that was how we met. And it was by a serendipitous, this person that happened to know both of us, but definitely a shared vision and mission. And we make decisions so fast because we're so aligned. It's just like, yeah, we're gonna do that. So that's my version. You want to
What's
add anything to that,
your
Avi?
version
No,
of
I
it?
think that was terrific. I will
Oh.
say, I will say that look, for a lot of years, I was helping behavioral health companies grow and helping families and people around the country and world connect to their mental health care, their addiction treatment care, their clinicians. And for years, we wanted to be able to make an impact in the eating disorder category. Now, this applies to everybody here listening too. For years, we wanted to make an impact in the eating disorder sort of industry and field because we knew there's millions of people here that need care, and it's few and far between, right? The number of providers, the number of places that people could go, the number of solutions that were available to families, they just weren't there. And so there was nothing for us to do, because there was plenty of internet traffic, plenty of people are searching for it, but there were just long lines out of the few brick and mortar facilities that were there, and so there was nothing to be done. I think you guys can remember, some of you might know this. Once upon a time, it was like 2014, it was 10 years ago. We did this piece of content about what would happen if Barbie was a real life person.
Yeah.
And some of you might know it because it ended up being in schools, and it ended up being in like in hospitals, and it ended up being like in over 100 countries. But the headline is, if Barbie were a real life person, she wouldn't be able to hold her head up because her neck is too small. Her body wouldn't be able to contain her organs. She'd have to walk on all fours because her wrists and ankles were depicted too small. And it's not a realistic survivable body. And yet that's what we've thought about for beauty for generations. Anyway, point is that it was after that. I was like, wow, there's a lot of people here that resonate with this thing, and yet there was nothing for us to do. I do have sort of personal history, and so I'd always wanted to be something I wanted to do. And then when I met Wendy, it was like, oh, okay, this is how it's supposed to happen. Like I didn't know this is what it's gonna look like. And so it was a really wonderful sort of time.
I love that. It's perfect. It's the right energy. I think you two are the greatest balance of one another. I think you balance you balance each other out with your energy, with your ideas, and with your enthusiasm about within and just the mental health community as a whole. So let's get into our first question. And you answered some of this, but what inspired the vision behind creating an intentional remote eating disorder treatment program, and how do you see it transforming the landscape of care?
Yeah, I mean, we talked a little bit about it, just by the, the hypothesis that like, oh, people cannot work, recover in their home. They have to be in a brick and mortar. That was sort of something I believed. And we certainly at Within do believe and value the brick and mortar presence in the space. And we refer to brick and mortar, and we take people as a step down. So I think all of these forms of care are incredibly important and valuable. I think a couple things that really made a very big influence on me in my career as a psychiatrist was developing a program which is called PACT, which stands for Program for Assertive Community Treatment. Those programs came about after the Olmstead Act was passed, which was a federal mandate to treat people in the least restrictive environment, with the concept being hospital without walls. So some people in Wisconsin in the 70s got this idea of like, what if we took all of the care that's like available in a hospital setting, the nurses, the doctors, the behavioral health techs, the dietitians, everybody. What if we actually took all that staff and brought them out into the community and helped people get stable housing, and we went and treated them in the home and took care of them and all of the things that happen in their life if we were there, So basically it's like about instead of the patient being in our world, we are in the patient's world in the PACT model. And I was astounded by the impact we were making when I had the blessing to do that program. And I got to work with my patients. I mean, I would take patients to the grocery store and do their mental status exam, doing a grocery shopping trip with them and things like that. And we had intensive case management. So the case management systems a lot of times have way too many patients for a case manager. So it's that small, intimate case management system. And it was like, this is profound. And I always wanted to integrate PACT into whatever, I always had that in my mind. And so when the idea of Within came, I was like, this is really like integrating like acute treatment, but also it's like it's got this element of PACT within it, where we're in the home and we're tackling the person's issues that they face in their world. It does have to be very intensive. It has to be very attuned. It can't be watered down treatment. It is really a very comprehensive, intensive program, but it is delivered in the home. And so PACT really had a huge influence on my career, and it has a huge influence on everything I do now because I think the models of care where people just go away to treatment for short durations and then get thrown back into their environment, I think it's honestly, it's like kind of archaic to think that people are going to do well. This level of care of being in the home, it's really necessary. Because if you really think about it, stepping people down from acute treatment where they have a contained setting and a designated treatment team, and now they're in the more stressful environment, they don't have the same level of services. They're not working with a team that, I mean, it's kind of crazy to think that they're going to do well if you really think about it. So I always say, is the patient treatment refractory or did they not really just get the treatment they needed? This level of care is needed where we're doing this intensive work in the home with this gradual step down from our PHP plus to our IOP plus. It's making a huge difference. And it really means a lot to me to be able to do this. But it's really PACT that had such a huge influence on me.
I like what you were sharing because it seems like within is like a version of PAC like 2.0.
It
And
is. It
it's
is.
coming into fruition. And you're right. And I think it is very unique that time from a discharge from a traditional brick and mortar or residential, and then you go home and you're back in this brand new environment. And we're able to really give our clients the opportunity to be in their environment and bring recovery to
Yeah.
them having to go to recovery. And I really think that's a good balance for those clients that are ideal for this
Yeah.
type of
Yeah.
support.
And it also allows people to get treatment much easier. They don't have to get so sick to then need to go to a residential. We can do much earlier interventions because it's just not as hard to actually do treatment. We actually ask people to sacrifice a lot when they go to traditional models. So that's some of the inspirations of within that Abby and I share.
Thank you. Abby, I'll give this question to you. What unique aspects of within truly set it apart from other eating disorder treatment options available today?
Unique aspects. I really like what I think this builds perfectly on what Wendy was talking about, right? If we're going to do something, it has to be different. If we're going to do something meaningful, right, with all of the skill, with all of the people, with all the talent we've got, with all the opportunity there, and we can't sell it short, right? And given, one of the things that really struck me about, can you all hear me? I think there seems to be an echo. Um, there we go. One of the things that always really struck me about working in this field and with this population is how occasionally extraordinarily sick people can become. And if you know, for the people, especially on this webinar, who've worked in the category, some of you guys haven't, but the world gets really small, right? And there's a lot of shame. And I liken it to, and for it's one of the few disorders, the few illnesses you can think of that someone's really, I mean, where stigma is so high and people are so afraid to say they have it. People are told and they live their lives with counter indicators where people telling them how good they look. And so it reinforces them to stay sick. And if this all was meant to say, right? If we were going to build a solution for that, right? It was going to have to be extraordinary. And what you just heard a moment of, and what I hope we get to hear a little bit more of, is that, and the reason I wanted to partner with Wendy is because she has a very specific and an informed and an expert point of view as to what needs to happen for people in order to get well. And often that still doesn't exist in when it comes to addiction treatment, right? People don't necessarily know, even today, what it takes to get someone sober. But with eating disorders, look, it's not a lock. There's never a guarantee, but Wendy has a very informed and expert as informed and as expert a point of view as there could be in terms of what it's going to require. And what I know now, and what we've learned also, is that tech allows us to do things that weren't previously possible, right? So on the heels of Path, right? We now have some ERs in rural parts of the country that can provide emergency medicine where the doctors and the nurses are fully remote, right? Imagine that. If we can do that, right? We should be able to provide medical care in someone's home. We should be able to provide companionship. We should be able to provide all of these things. Now, Wendy talks about human connection, and that was the litmus test, right? Can we actually create a bond where people love each other and can feel that love and can feel held and safe, even though someone may not be at their table with them? Turns out, yes. Right. And it even goes further than that sometimes, because now I can take someone with me to the grocery store. I can take someone with me to this place where no one's ever gone. Right. But it's safe enough because they're with me remotely. So I feel as though when we can allow not just nursing to happen remotely, but food and exposure therapy to happen around someone's kitchen table, and they can be in a group with others, and yet at their kitchen table where it might be a little safer, right? So these are the things that, in addition to now, right? I'll add a little bit more. What we can also do now, right? In addition to providing sort of insights and wearables that provide insights to clinicians, allow them to spend their time with patients, but we have the tech and the stack, the technological stack that allows an interdisciplinary team to work together across state borders,
Yes.
and scale, right, efficiently, in a way that keeps the focus on the patient. So Wendy says, right, whether you're in a group of 12, whether we have 12 patients or 1,200 patients, you still feel like you're in a group of 12 people.
Mhm.
And so all of those things, and more, because it lays the groundwork for much more that we're able to do. But what's been extraordinary in this time that we've had is that we've been able to prove that people will get better. People that we can take that are very sick, because that's Wendy's brand. We can take those people, and they will get better, and get the freedom that we know is possible.
I love that because there is exactly what you're saying, that intersectionality of technology and healthcare. It reminds me of the Jetsons and the Flintstones, right? The Jetsons kind of moving forward, and they had everything then that we are using now, which is, pretty interesting. But
Wow.
integrating the two family systems and building off of one another, which brings me to my next question for you, Wendy. It says, here, in what innovative ways, and you touched on this a little bit, does Within ensure that its intentional remote model of care is just as comparable? And you mentioned the PHP and IOP plus, so I would love to hear, exactly what that is, because you don't hear the plus after when you're, looking for
Yeah.
programs.
Right. Well, thank you for asking that. I mean, first, I just want to say, kind of piggyback what Abhilash said, that I think that it is important, to build a program that you have conviction and an understanding of like what it actually takes to help people recover. So when we built Within, the reality of it is that, treatment models were designed not based on necessarily what does the patient need. It's more based on like, oh, we're going to just build these programs 3 hours, 6 hours, whatever, this is the hours 8 to 4, like 4 to 7 or whatever. It's not really based on like, okay, what's really the best thing for the actual human being here? So when we did this program, we knew we needed to be safe medically and psychiatrically. So with regard to the remote monitoring, not only do our patients have a very thorough assessment pre-admission for medical and psychiatric acuity, but an ongoing medical monitoring process using our Within um, design remote modeling, remote patient monitoring, which includes getting blind weights, orthostatic vital signs. We can check temperature. We are now checking out using a ring that helps us with sleep and heart rate variability and things of that nature. So really being able to work with people in the home, we have an anchor of a nurse for all of our patients. I truly believe that nurses really capture a very important field of medicine that's very helpful to people with eating disorders, because nurses are very well trained in the humanistic model and the biopsychosocial model. So they have a foundation of all area domains that are required. So using the nursing staff in very tight coordination with the PCP and the person's home community, and the remote patient monitoring that we can do up to 7 days a week. So we really have a good sense of what's happening with the patient, and a really skilled team. We're able to deliver this care in a way that hasn't been done because we can work with these very compromised patients, or we can work with people really early in the course of their illness. Either one we can do. And why I always am very a stickler about using the plus, which anybody who's around me, if you call within a PHP program or IOP program, I'll go, plus, plus, because I realize I'm not going to take away from the fact that there isn't a program out there that's doing remote care that comes even close to doing what Within is doing. Not all programs, not all residential programs are the same. Not all PHP programs are the same. You have to actually be discerning and know what's being offered and why it's being offered. So why we are a plus is that first of all, we have an app that we designed to work with people in their homes so that we could have heightened connectivity between the care providers and the patient, heightened monitoring, heightened support, and really being there for people. We're not just there for you during the 3 hours or the 6 hours or more that you're with us. We're with you in our app. We have direct chats with folks. We do meal check-ins. We have a living room where people can come and sort of hang out in between sessions. We have some protocols that patients can work through themselves using DBT skills to help them process tough emotions, and more. The app is something that's constantly evolving. So we have this app that heightens the connectivity, and the living room is available till 10 p.m. in the person's time zone. The program isn't just centered around our schedule. We say, what's your schedule? What do you need to do? Like, are you a parent that has to get your child to school so you can't do programming, between 7 and 9? Are you a student that needs to take that anthropology class that's only on Tuesday and Thursday in order to graduate, Tuesday and Thursday at 4? So, because in the past, a lot of programs, a lot of the care, what I heard from providers is a lot of times we would blame people for not coming to our programs according to our schedule. And we'd say, oh, they just don't really want to get better. They haven't hit rock bottom. I'm not working harder than the patient. And that is really out of touch with patients' experience. What about people who have to work just to pay the bills, to put a roof over their heads? So we can straddle our care. I hadn't even thought of it when we started. We could do a PHP program with 1 hour here, 3 hours there, 2 hours there. We can wrap it around your life. And so that's a little bit about it, and that's why it's called Plus. We also deliver food into the home. The reason we do that is that every meal is exposure therapy. Every meal is work. Every meal is a step in the direction of recovery. Um, for programs that are telling PHP patients to bring their own food, I find that very questionable, because if I'm a patient with an eating disorder and I need a PHP level of care, I'm just kind of doubting I'm going to bring a grilled cheese sandwich with tomato soup with croutons in it to my lunch. And if the person doesn't eat the food that they need to eat to recover when they're in treatment, they are not going to be eating that food when they leave. So if you want people to recover, people have to eat the food that is scary, because that's how you recover, exposure therapy. So that's a little bit about that.
You both mentioned the importance of the interdisciplinary team approach, and I think it's very special, the interdisciplinary team that we have at Within. Can you share a little bit about who makes up our team for our clients?
Wendy, you want to go ahead?
Okay, I'll just quickly, I mean, we have one thing about Within that I know a lot of folks out there really appreciate is that you might be an outpatient therapist, but you don't have that whole team. It's very hard to coordinate care. So all of our patients have this access to psychiatrist, nurse, therapists, PhD level and master's level therapists, care partners, registered dietitians, food specialists, care coordinators that coordinate the schedule. Believe it or not, there's actually a lot of work around that when you're working with people the way we do. And so that's like the actual interdisciplinary team that's working with the patient. We also have a person whose specific function is just to make sure that there's communication between our team and the person's outpatient team. We place a great emphasis on that. So that's a little bit about the care team, but it is a definite multidisciplinary team. There's about 65 plus groups available in 4 time zones, so that we can build that group and individual schedule around the person's life.
No, I think that's so amazing. And I think it's so worthy to mention that, because one of the things that we hear often is, how does it work? Who's working with the client? it's truly just an experience that you have to just be a part of to understand the magic. I like to call it the magic that is happening behind the scenes to make sure that our clients are being taken care of and that we are dotting every I and crossing every T, and also including their families and their support systems, and creating a space for them also to be able to understand and know and learn and walk away with some very helpful takeaways on how to move forward. Abby, I'll give this next one to you. How do you effectively track and celebrate patient progress and outcomes over time in this intentionally remote environment?
Sure. I'll say a little, but then I think it's important that I think we hear from Wendy on this one too. Uh, we knew if we're going to do something different and do something unique, that it wasn't going to matter and people weren't going to believe us unless we had really diligent, thorough, and transparent sort of, I'm not going to call it performance, but really it's tracking of how our patients are doing. The I think someone just put it in the chat too. The massive challenge to doing this is having insurance payers accept and create access for patients to be able to reach this kind of care. It's a care desert across 98% of the country, not to mention the world. Now, if they're going to believe us, we have to be able to show that this works. Wendy didn't even know if it was going to work when we started. Like, is this even going to work?
I
So
didn't.
we needed to be able to do that with veracity, with rigor, and with skill. Dr. Caitlin Shepard leads our clinical research team, and we're grateful for her from the start because she has a wealth of knowledge and capacity and capability, competence, and that rigor she brings, which allows us to show that on multiple scales, apples to apples, exactly the way that a brick and mortar would track it. This is how within patients do, and as it turns out, they do better, right? Often, and I'll qualify it in that regard. But what we want to be able to do, right, is publish that. Now we've just published a report that Wendy's going to go into, but what we want to be able to do, and what tech allows us to do, right, is to get more thorough, more real time, more interactive, and even then potentially predictive, right? Because what the more data is going to allow us to do is be able to show, well, patients that come from this place with these factors that do these things that came from this way tend to exhibit maybe these characteristics, and when these things happen, this is what the outcomes are. Like the more data we have, the better we're going to be able to do, and so there is a snowball effect here. We're extraordinarily proud of the work that's being done, the work that has been done. I want Wendy to get to share on this, but where we're headed is also extraordinarily encouraging and motivating, because it means that, wow, we've captured a lot, but this really informs us and allows us to make really good decisions from here that will impact more people, and most importantly, well, maybe not most importantly, but most necessarily, get the insurance companies to open the door for more people.
Definitely.
Definitely. And I think there was a question in the chat, and Wendy, you answered it about our ability to work with insurance. And I think we have to shut out that is something that we are constantly doing, is contacting and communicating with insurance companies, and really sharing and creating the data that they need to see in order to know that this is something that, definitely, needs to be considered and taken seriously. So more to come on that, and we will have more from Dr. Shepard. Just want to give her a quick shout out. Thank you, Abby, for mentioning her. We will definitely hear from Dr. Shepard, who heads our outcomes report. We just published our outcomes report not too long ago, and we will share that information again with all of you. So you will be able to see just, what we've been doing over the last couple of years. And I think it's also worthy to mention that Within is not that old to have covered this much ground and to be doing the things that we're doing. So we are definitely working hard, and we will have more information during the summit for you to learn about our outcomes and how we're doing those things. Um, this is something that's very special to me. Once patients complete the program, what comprehensive follow-up of care do we have for our clients when it comes from an aftercare portion? And I would just love to share that our alumni program is something that we hold near and dear to our heart. When I joined the Within family back in 2022, we had an alumni group and we were inviting our clients to come and participate. And now we are happy to share, and we will hear more from the alumni care team during the week. But we have 6 different offerings that we have for our clients, and we have very specific spaces for them to come and process what it's like to be back on their regularly scheduled programming, we often like to say, and what it means to not be within the arms of Within, but to still be connected to us. And one of the things that we do is we have an opportunity for our alumni clients to reconnect with our staff. And Abby, you had the opportunity to come to one of the alumni groups. Would you share just a little bit about what that experience was like for you to connect with clients that had gone through the program and were back out into their regular lives?
Tears. I don't think I've ever been, I don't know why, but I don't know that I've been in a handful of these alumni meetings and there's always good tears, tears of joy. Like it's extraordinary. And there's sometimes here's what's special, right? Many programs, regardless of what they do, um, don't spend enough time on their alumni, right? The resources just don't go there because as a business, they spend their resources wherever they spend them. We knew we needed to do better. And so it's always going to be an effort. It's always going to be a purpose that we have to extend and expand and grow the resources that we have for our alumni. Not because we want them to come back, but because we want them to do well and because we owe it to them. And so in this alumni program, what was amazing, there were people who were doing well, picking each other up, supporting each other, loving each other. There were some others that had to discharge. I'm going to be honest, like some of them had to discharge because one in particular had to discharge because her plan changed, her insurance plan changed, and her new plan wouldn't cover the care despite all these appeals, and made her go to a brick and mortar like place that's in her area, and and she was doing it but didn't feel it, like. And so she wanted to come to the alumni groups, and she was coming to the alumni groups, and she got to share, right, and she got to be someplace where she felt safe. And so it's fine, like someone that discharged it didn't see it, that's okay, come on, right. And we all got to spend time together. And one person who had adopted a young daughter, a 4-year old girl, right? She'd adopted her, and was scared, and she was scared about a pizza party that we're going to go to. We we picked her up, we just loved on her, and then that night she was able to go to that party, wear a swimsuit, have pizza at a pool with her 4-year-old, and her 4-year-old felt joy, right? And safety and family. And that was really special. Like hearing from someone else from the care team. I didn't know about any of this until I got it through the messages that we get to share with each other, these wins. And seeing that, my heart rose, and I was excited to come back the next day to see what happens.
I love that. I think it's also, worthy to share that you both, as the founders of this program, make yourself accessible to our clients, which is very rare. Very rarely do clients have this much access to clinical leadership. And I think you've laid the foundation for them to know that just because we are on Zoom and we're in these squares, we are very much connected and we get to know one another. I have never met you, Abby, in person, but I feel like I feel like I know you, and that is the energy I think that is present and felt, in our program with our clients and amongst our staff. And we have time for one more question. And Wendy, I'll ask you, and Abby, please hop in. Are there any clients that stick out or any success stories that you can share that you feel would be helpful for our audience to hear today? I know that Within started, like I said, not very long ago, and we have some very memorable clients that were some of our first clients. And
Mhm.
wondering if there's anyone that just kind of sticks out to you.
Sure, sure. Well, there's so many. I mean, our ARFID population sticks out to me. I mean, I just go on and on. One of our very first patients was a woman living in a very rural area of Nevada. She was living in a larger body. She actually had a broken foot. She was a veteran of the military, of the Navy. She was a trauma survivor. She had been raped. She had severe major depression. And she had binge eating disorder as well. And she also used a lot of Ambien. She also had she also used like the gummy, she used THC. Like it was just a whole lot of different things going on. She would have never ever had access to care if Within wasn't with us here. And she had so much body hatred and she was so disconnected from her body. I remember the first movement group she ever went to, she said she literally left 6 minutes into the group and she felt like her body, what she felt like was jiggling. I don't mean to trigger anybody, but this is how she felt. And so she was so dissociated from her body that she couldn't even be connected enough to actually do any, even the most gentle movement. She was with us quite a while, and really got to process a lot of her trauma that was really the core of so many of her symptoms, and got so much love and care, and really shifted from that self-hatred to self-compassion. That is one of the paradigm shifts that needs to happen in order to recover. And self-compassion is based not on judgment, but on knowledge. So reducing judgment of yourself and increasing knowledge actually increases self-respect. And self-respect is like kind of a foundation for self-compassion. So she made that paradigm shift. She learned how to become a mindful eater. By the way, those living in larger bodies with binge eating disorder are very, 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 very restrictive around eating very often. By the time she completed program, she was actually making requests to do go on walks with her different care. She would go on walks through the app with her care partners. She had started taking a movement class in her home community. She and her husband would go on walks together with their dog, and she just really totally changed her outlook. Her whole entire outlook on life was different. As mentioned, she used gummies, she used Ambien, she had night eating. All of these things were almost completely ameliorated during her time. She did participate in alumni. She still does from time to time. We actually did a case report that was published in the Journal of Eating Disorders, International Journal of Eating Disorders, if I have that one correctly. I always get confused with the different names of journals, so if I have that wrong, sorry. But that was one of the cases she was in our group. We admitted 4 patients on June 15th, 2021, and she was one of the 4. So that's one of the stories that I hold so dear to my heart. And Abhilash was really generous and we both agreed that at that time, mentioning insurance didn't believe in us at all. So we just brought people in and we billed the insurance, and whatever they paid us, we took it and we treated them to completion. And that was a part of the evolution of our whole treatment, is just to work with people and see what they need and build the care around what their needs are. And that's another piece of what makes us work, is that we build the care around the patient. That's what we did for that patient. And it works. It actually is an effective treatment. We do have amazing outcomes that Caitlin will go into. But at the time of discharge, 70% of our patients no longer score in the clinical range for eating disorders. 65% are out of the range of depression. We do have a significant number of patients that admit with high levels of depression. And close to 90% of our patients report that they're satisfied with our services. Dramatic improvements in quality of life that are on par, or comparable, or even better than some brick and mortar reports. So just the assumption that brick and mortar is superior, that's not a correct assumption. It's definitely needed. All these levels of care are needed. And we're just glad that we're here together and we just have the chance to actually work with our amazing, amazing patients. That's the biggest honor of all. To get to touch these lives and have these memories like Abhilash has described, and to carry that forward and to know that that's a part of our daily life, like that's what we do every day. It just never feels like work to me. It's just the most meaningful thing I could have ever possibly imagined. That's a byproduct of my own eating disorder, which I never thought would be anything that would be a source of joy for me. So it's incredibly meaningful. And that's kind of why we're all here together is through that shared desire to have meaning in our lives and make a meaningful impact on the lives of our patients.
Thank you both so much. We are already off to an amazing start to this year's summit. To the rest of you out there, stay tuned. We have our next session coming up with the amazing Chrissy Stockard. So that will happen in just a moment here. And please remember your CEO dashboard is going to be your navigation, your best friend for the remainder of the week. All of the information, all of the materials, the schedule will be available, and you will continue to get email updates, and I will have my contact information should anybody have a question around anything. And we will see you at 11. Wendy and Avi, thank you so much for your time. And I hope
Bye, you guys. Thank you.
Thank you so much, everyone.
thank you.